Welcome to the Practice Impossible podcast with your host, Coach JPMD. That's me. This week, we're going to discuss 5 reasons to embrace managed care practices today. But before we get into those 5 reasons, I want to say a couple of things. One of which is actually a story on my 95-year-old patient who I saw last week. I came out of the room dying of laughter with tears coming down my eyes because I just couldn't believe he said what he said. But he'd come into the office. I'd been seeing him for over 20 years. I saw his wife who passed away, and he's just a nice gentleman. But his blood pressure was 205 over 104. Came in with no symptoms, no chest pain, no shortness of breath, no visual changes. I was concerned, obviously. So I called my MA. I told my MA to give him some clonidine before I even started the visit, just to see if we can get his blood pressure down. Gave him his blood pressure medicines, talked to him about his symptoms and what he's going through, and how he's been opening up his house to some family friends who had some problems with their home, and he was doing okay. And at the end of the visit, I said, "Hey, we'll come back and check your blood pressure." And he looked at me and said, "Doc, why are you trying to keep me alive so long?" I'm like, "What do you mean?" It's like, "Doc, I'm 95 years old. What are you trying to do?" I said, "Why are you doing this?" And I said, "Because I like you." And he just busted out laughing. And it was interesting to see his perspective on life. And here I am trying to do what I think was the best thing, but he was just puzzled as to why I was doing everything for him. And it was just it was a funny story for me. So, I wanted to go over my why, because September 17th, if physicians don't know, they should know that September 17th of this past week was a Physician Suicide Awareness Day. And I'm not sure if many people understand the seriousness of this day and of the statistics that surround physician suicide. And we as physicians commit suicide 1.8 times more than the general population. And that's a daunting number. And physicians need to understand the business of medicine. They need to understand that in order to survive and thrive in this really, really stressful culture that we live in and that we work in, and the culture that we live in. And one of the things that I have become passionate about is teaching physicians, and through my courses, through coaching, and through even this podcast, my goal is to decrease physician stress and increase profits to all physicians. And I want to bring awareness to the support that physicians have through Physician Support Line at 888-409-0141. And that line is available from 8 to 1 a.m. every day. And there's also Pamela Weibel. Dr. Weibel has been a champion in bringing awareness of physician suicide in our community. And she can be found at idealmedicalcare.org. And she's a wonderful resource and really is a champion to the cause. And, it's important for us to continue to support each other and do what we need to do to take care of ourselves, because if we're not able to take care of ourselves, then how can we take care of our patients? So I want to go over the 5 reasons why we need to embrace a managed care today, because that's one thing that I think that we can do as physicians to help decrease our stress and increase our profits. And I'm going to go rapid fire through the 5 things, and then we'll go into detail. First thing is we need to embrace it, because 48% of our Medicare enrolled patients are going to be in a Medicare Advantage plan, as per the latest statistics. Number 2, it's a niche practice. Not many people are doing it. Number 3, one of the best ways to see and manage a set of patients or a patient population over a long period of time is to see a Medicare Advantage patient or managed care patient. Number 4, it's guaranteed income. And number 5, the fifth reason to embrace Medicare Advantage practices is so that you can develop a great referral team. So number 1, 48% of Medicare patients that are turning 65 or that are eligible for Medicare are enrolled in a Medicare Advantage plan. So if that's the case, that's half of the population of patients that have Medicare are going to be in a Medicare Advantage plan, whether it be through United Fee-for-Service or through a managed capitated plan. Those are real numbers. So we need to understand these numbers as specialists, and particularly as primary care providers, because we're entering a a stage in the U.S. population where a lot of our seniors are turning 65 and they're going to need primary care doctors to take care of them. And if we're around and we understand this well, we'll do really, really well as physicians. Number two, it's a niche practice. I don't know what the statistics are and how many primary care physicians are seeing Medicare Advantage patients, but in any niche business or any niche practice, you stand to do very well if you know how to manage that business or that population or that customer or that patient base. Not everyone is doing it. And if you do it well, you can make a great living. And the number one way to do this is to keep patients healthy. So screening exams, seeing them frequently, and also keeping them out of the emergency room in hospitals. We know that, at least in my population, over 50% of patients who hit the emergency room will end up being admitted to the hospital. So if we can keep our patients healthy by doing the screening tests and seeing them often and treating problems early, coaching them on how to live a healthier lifestyle, then that's going to mean more money in your pocket in this niche practice. And if you know how to do it well, then that will definitely decrease your stress. And number three, one of the best ways I think to manage a patient population is to see managed care patients. Because if you manage those patients well, so let's say you have a Medicare Advantage patient that's 65. The U.S. life expectancy unfortunately dropped by 3 years this year in 2022. If you see them for 15 years or so and you do a good job, keep them out of the hospital, you keep them healthy, then you develop a deeper relationship with your patients. And that in turn really guarantees your income. That goes to the number four, but we'll get to number four. And fee-for-service patients tend to move with their jobs. So if you have a patient that's on a United Healthcare or Blue Cross Blue Shield and you start to develop a relationship with them and you're treating their chronic medical conditions, but then they change jobs or they move, then so there goes your income. There goes your patient population. So I think it's really a keen way of managing a patient population over a long period of time and allows you to, like I said in number four, guarantee an income. Because if you've got a patient that's 65 and has Medicare or Medicare Advantage plan, then you know what, you don't have to worry about them paying you because the government will pay you. So that's, for me, a no-brainer. And number five, you can develop a great referral team with managed care patients. What do I mean by that? It's almost like residency. In residency, you remember when we were seeing patients and we needed things done, you'd go to your friends that are rotating in surgery or rotating in infectious disease and say, hey, I have a case I need your help on. Can you please round early so I can discharge a patient early? Or you text the attendings or you have conversations in the hallways. Well, in managed care, I have a great team. I have a team of consultants that if I call them, they are responsive to me. I had a patient actually today who had been in the hospital, had a nephrostomy tube placed, and she was really anxious. She had a nephrostomy tube, and she had been trying to call the urologist that inserted the nephrostomy tube for over a couple of days. Her son was involved. I tried to call the patient, the urologist, and he was in a room and wouldn't come out to talk to me. Now, this is a urologist that I don't usually refer to, and the patient had gone to an emergency room and was admitted and had a complicated hospital stay. I really wasn't involved in her care, but if she was in my network, she would get the response that I usually get from my specialist. I texted my urologist, and he texted me same day, and I'm going to be in communication with him, and unfortunately, I'm going to have to switch her urologist so that we can get that nephrostomy tube taken care of. So that's the beauty of having a good referral team, because then that allows us to manage patient populations better. So I wanted to tell you what these 5 things were. There are 5 reasons to embrace managed care practices today, because it's something that is not going away. It's popular. It's what patients are looking for. And it's what I think is going to help decrease physician stress and increase profits. And hopefully, if we do that, then we'll have an opportunity to help decrease this crisis that we have in our profession, and that's with the physician suicide. And again, if you have any thoughts, any help that you might need with your stress, please, contact a colleague, contact a friend, call the physician support line at 409-0141. They're open from 8 to 1 every day. If you like the episodes, you follow me, share the episodes with your friends, and just keep practicing impossible, because that's what we do here.